Welcome to the Health Horizon YouTube channel, your go-to source for everything related to your well-being. Have you ever wondered if there are early warning signs of a stroke that you can spot before it's too late? What if you could identify these symptoms and take immediate action to prevent a devastating event? In today's video, we're diving deep into the two main types of strokes, ischemic and hemorrhagic, and revealing the key warning signs that could save your life. You'll also discover the most effective strategies to prevent a stroke from occurring in the first place. Whether you're concerned about your health or simply want to stay informed, this video will arm you with vital knowledge. Stay tuned until the end, because the simple tips we're sharing could make all the difference in reducing your stroke risk and living a healthier, longer life. Let's get started. Understanding stroke types, warning signs, and prevention tips. A stroke can be a terrifying experience, but it's important to know that there are warning signs that may appear before a stroke occurs. Recognizing these signs early and taking preventive steps can make all the difference in reducing your risk of a stroke. In this comprehensive guide, we'll discuss the two main types of stroke, their warning signs, and practical tips for prevention. Types of stroke. Strokes are classified into two main types, ischemic and hemorrhagic. Understanding these types can help you recognize the risk factors and identify the symptoms early. 1. Ischemic stroke. This is the most common type of stroke, accounting for 80–85% of all cases. Ischemic strokes occur when a blood clot or plaque blocks the flow of blood to a particular part of the brain. This blockage disrupts the oxygen supply, causing the brain cells in the affected area to die. There are two main causes of ischemic stroke. Thrombosis. A blood clot forms within a blood vessel in the brain, often due to plaque buildup. Embolism. A clot or other material like fat or air forms elsewhere in the body, then travels to the brain, blocking a blood vessel. 2. Hemorrhagic stroke. This type of stroke is caused by bleeding in or around the brain. It accounts for about 15–20% of strokes. Hemorrhagic strokes occur when a blood vessel in the brain bursts, spilling blood into surrounding tissues. This can lead to brain swelling, increased pressure, and possible brain cell death. Hemorrhagic strokes can be caused by aneurysms, weak spots in blood vessels that can rupture, arteriovenous malformation (AV), abnormal connections between arteries and veins, which can cause ruptures. Though ischemic strokes are more common, both types are equally dangerous and require immediate medical attention. Warning signs of stroke. It's important to be aware of the signs and symptoms that could indicate a stroke or a transient ischemic attack, TIA, often referred to as a mini stroke. These symptoms can happen suddenly, and recognizing them early is critical for preventing permanent damage or even death. Here are the most common warning signs of a stroke. 1. High blood pressure. Blood pressure, or hypertension, is one of the leading causes of stroke and one of the most important warning signs to monitor. Even if you don't feel any symptoms, high blood pressure can be damaging your blood vessels over time. It makes the vessels weaker, increasing the risk of clot formation or vessel rupture, leading to a stroke. It can also exacerbate the buildup of plaque in the arteries, contributing to ischemic strokes. Regularly checking your blood pressure even when you feel fine is vital. If your blood pressure is elevated, take steps to manage it to reduce the risk of stroke. 2. Unusual headache. Headaches can be caused by many things, but if you experience a sudden, severe headache that feels different from any headache you've had before, it could be a sign of a stroke. This type of headache is often described as being sudden and intense, sometimes accompanied by blurred vision or dizziness. In cases of hemorrhagic stroke, the headache may occur due to bleeding in the brain. In the case of an ischemic stroke, reduced blood flow may lead to an abnormal headache. If the headache is unlike anything you've experienced, seek medical help immediately. 3. Numbness on one side of the body. Numbness or weakness on one side of the body is a classic sign of a stroke or TIA. This happens because a stroke affects a particular region of the brain that controls the opposite side of the body. For example, a stroke on the left side of the brain can cause numbness or weakness on the right side of the body. This might manifest as a loss of sensation, like tingling or pins and needles, or a loss of strength, making it difficult to lift your arm or leg. If this happens, even temporarily, it's crucial to get immediate medical attention. 4. Speech difficulty. If you or someone around you suddenly experiences difficulty speaking or understanding speech, it could be a sign of a stroke. This could range from slurred speech to not being able to find the right words. Sometimes, people may sound confused or have trouble following conversations. If someone suddenly has difficulty speaking, even if they seem fine in other ways, it's important to take this as a red flag and seek medical help immediately. 5. Balance problems. Sudden balance issues or dizziness can also indicate a stroke. If someone appears to be stumbling, having difficulty walking, or seems off balance, it could be due to an obstruction in the part of the brain that controls coordination and balance. It's not uncommon for people experiencing a stroke to be mistaken for being drunk, due to the impaired motor control. If you notice a person suddenly struggling to maintain their balance, it's crucial to get the medical attention right away. 6. Excessive fatigue. Unexpected, extreme fatigue or tiredness that doesn't seem to have a clear cause can also be a sign of stroke risk. Many stroke survivors report feeling unusually tired or weak in the days leading up to their stroke. If you're experiencing this kind of exhaustion without an apparent reason, it's important to consult with the healthcare provider to rule out any serious issues. 7. Motor coordination problems. Struggling with fine motor tasks, such as using your hands for daily activities like brushing your teeth, using a computer, or even washing dishes, can be a warning sign of a stroke. This might not manifest as complete paralysis, but as a subtle change in strength or coordination. If you notice that one side of your body feels weaker or less coordinated than usual, don't ignore it. Seek medical advice. 8. Vision changes. Sudden changes in vision, such as blurred vision or double vision, should always be taken seriously. These visual disturbances can occur due to a reduction in blood flow to the areas of the brain responsible for vision. In some cases, visual problems can also be a sign of a TIA or impending stroke. If you experience any sudden changes in vision, it's critical to get checked out by a healthcare professional immediately. How to prevent a stroke. 9 key tips. While recognizing the warning signs of a stroke is crucial, preventing a stroke is equally important. Many strokes can be avoided by adopting a healthy lifestyle and taking steps to manage risk factors. Here are 9 tips that can significantly reduce your risk of having a stroke. 1. Reduce salt intake. Excessive salt consumption can lead to high blood pressure, which increases the risk of stroke. Most Americans consume more than the recommended amount of salt, which can cause fluid retention and raise blood volume, ultimately increasing blood pressure. To lower your stroke risk, aim to limit your salt intake to 5 grams per day, as recommended by the World Health Organization (WHO). Check food labels and avoid foods high in sodium, such as processed foods and restaurant meals. 2. Control blood sugar. Maintaining healthy blood sugar levels is essential for preventing stroke. High blood sugar, commonly associated with diabetes, can damage blood vessels over time, leading to atherosclerosis, the buildup of plaque in the arteries. This condition significantly raises the risk of stroke. Managing your blood sugar through a healthy diet, regular exercise, and medications, if necessary, is key to reducing your risk of stroke. 3. Avoid smoking. Smoking is a major contributor to cardiovascular disease, including stroke. Cigarette smoke contains harmful chemicals that damage blood vessels, increase blood pressure, and promote clot formation. Whether you smoke cigarettes, cigars, or use e-cigarettes, quitting smoking is one of the most effective ways to lower your stroke risk. 4. Manage your cholesterol. Cholesterol, particularly LDL, low-density lipoprotein cholesterol, plays a significant role in the development of plaque in your arteries, leading to an increased risk of stroke. While cholesterol is necessary for many bodily functions, it's important to manage your levels. Aim to keep your LDL cholesterol low and your HDL, high-density lipoprotein cholesterol, high. Regularly monitoring your cholesterol levels and working with a healthcare provider to manage them is crucial for stroke prevention. 5. Exercise. Regular physical activity is one of the most effective ways to lower your stroke risk. Regular exercise improves circulation, reduces blood pressure, and helps maintain a healthy weight. Aim for at least 150 minutes of moderate intensity exercise per week, such as brisk walking, swimming, or cycling. If you're just starting out, try to break it down into manageable chunks, like 30 minutes a day, 5 days a week. 6. Control your weight. Excess body fat, especially around the abdomen, can lead to increased inflammation, higher blood pressure, and other metabolic issues that elevate your stroke risk. Maintaining a healthy weight through a balanced diet and regular physical activity can help reduce these risks and improve overall health. 7. Improve sleep. Obstructive sleep apnea is a condition in which your breathing stops and starts while you sleep, leading to low oxygen levels in your blood. This condition can worsen hypertension, diabetes, and other stroke risk factors. If you snore loudly or wake up feeling tired despite a full night's sleep, consider seeking medical advice. Treatment for sleep apnea can improve your overall health and reduce your stroke risk. 8. Monitor your blood pressure. Regularly monitor your blood pressure, even when you're not at the doctor's office. Blood pressure can rise temporarily during doctor visits, a phenomenon known as white coat hypertension. To get an accurate reading, check your blood pressure at home using a reliable monitor. Keeping track of your readings can help you catch high blood pressure early and take action before it leads to a stroke. 9. Check for arrhythmia. Certain heart rhythm problems, such as atrial fibrillation, can increase the risk of stroke. This condition can cause blood clots to form in the heart, which can then travel to the brain. If you experience palpitations, dizziness, or other symptoms of arrhythmia, it's important to get tested. An ECG electrocardiogram can help detect heart rhythm issues, and appropriate treatment can reduce the risk of stroke. Recognizing the signs of a stroke and taking steps to prevent it are crucial to maintaining your health and well-being. By staying vigilant about your health, managing your blood pressure and cholesterol, and adopting a healthy lifestyle, you can significantly reduce your risk of experiencing a stroke. If you experience any of the warning signs mentioned above, don't hesitate to seek medical attention immediately. Prevention is the key to living a long, healthy life, free from the devastating effects of stroke. Now that you know the critical warning signs of a stroke and the powerful preventive measures you can take, it's time to act on what you've learned. The key to reducing your stroke risk lies in staying proactive, monitoring your blood pressure, managing your cholesterol, and making healthier lifestyle choices. Remember, small changes can lead to big results in preventing a stroke. We hope this video has given you the insight and motivation to take control of your health. If you found this information helpful, don't forget to hit that like button, subscribe to Health Horizon, and share this video with your friends and family. Together, we can spread awareness and keep everyone informed about the critical steps to prevent strokes. Stay healthy, stay safe, and thank you for being part of the Health Horizon community.